What ethical considerations should be taken into account when prescribing hormone therapy, particularly regarding long-term effects and dependency?
Anytime you do anything for another human being, ethics come into play, and you should always practice ethically. You should always have the patient's best interest at heart. There should be no outside factors that drive your decision-making process. When I say decision-making process, it is the decision to either prescribe or not prescribe. The decision to actually move forward with a treatment or not always lies with the patient themselves. Patients have the right to deny any treatment, and you do not decide if someone will do something or not. You decide if you're willing to help them in the process. Your decision should always be driven by ethics, and those ethics should be based with an end goal of doing the right thing for the patient to improve their quality of life and improve their health. Sometimes it's contradictory. Palliative care is a common example where you may improve quality of life, but you're going to harm their health. But this is an end-of-life type of a treatment. What we're doing here is kind of like it's not palliative care, and it's not exactly, look, you're sick and I'm just going to treat you for better health. Because if you look at some treatments like cancer, you're being treated with chemotherapy. They are worsening your quality of life transiently, but they're improving your health long term. We're right in the middle. We're kind of saying, look, we believe that we're improving your quality of life, but at the same time, we're also lengthening your life. That's what we truly believe, and we do have literature to support it. As with anything in medicine, when you have literature supporting one side, you're going to have another one, against. So it's really hard to look at evidence-based medicine the way they want us to look at it and say, what does the evidence show? Well, the evidence is always usually going to show both. It kind of depends on how you interpret it. So, we hate to debate the philosophy of it. We just look at, honestly, after thousands of case studies, we looked at the anecdotal evidence. How do people feel? What is their time span? What is their longevity? What are other health markers doing? So we noticed that when we induce properly administered, key term I cannot emphasize enough, properly administered testosterone therapy, properly administered, properly management with good oversight. Because the term TRT gets tossed around, it means nothing unless we know the specifics. So properly administered, properly managed, properly supervised TRT, we've noticed a handful of things. Number one, symptom resolution is generally achieved in a relatively short period of time. Number two, we notice that a lot of markers in other arenas improve. Anemias are reversed. Sexual dysfunctions are reversed. Quality of life is enhanced. Mood and cognition are enhanced. People are starting to now throw away prescription medications. Hypertension is improved, and people are starting to now come off some of their antihypertensives. People have come off of statins. People have come off antipsychotics, SSRIs, SNRIs, benzos. They've tossed these drugs, which generally just masked an underlying problem once their hormonal balance has been restored. So ethically, I am completely confident in our decision to help somebody with treatment if they are, one, symptomatic, and two, especially if they show clear signs of suboptimal levels. You don't always have to have a clinical deficiency to be treated. Suboptimal is very subjective, and if you are symptomatic, and I see no harm in treating you, because he used the word dependence, nobody is dependent on anything when it comes to this. You're not a type 1 diabetic who will die without insulin. You're using testosterone. If you stop taking testosterone, you're not going to die. So you're not dependent. The quality of your life may feel like it's dependent, but you're not dependent. You are dependent on food, water, air, shelter. You will die without those things. You're certainly not dependent on your testosterone. So you can come off, and you can probably even start producing your own levels. Again, the problem is if you were suboptimal to start, you're going to be suboptimal if you stop. So you're certainly not dependent. I know that scares a lot of guys. But if you got on for the right reasons, really you shouldn't be stopping anyway. Just again, make sure that it is being treated by someone who understands how to treat, manage, and supervise your treatment on an ongoing basis. Your body is always evolving. Your metrics are always changing. The variables are changing. Metabolism changes. SHBG changes. Your needs and your lifestyle changes. And understanding how to change things on the fly to adapt to your needs prevents bad side effects from happening in the future and then spending months trying to undo them with someone else.